With more than 25,000 positive tests and 210 deaths, New York has become the epicenter of coronavirus cases in the United States, but in recent days, the numbers in Louisiana, New Jersey and several other states also have been skyrocketing. Louisiana, which reported no cases until mid-March, topped the 1,000 mark, and the state has seen more than 500 new cases reported since the weekend, with 1,388 cases and 46 deaths by Tuesday afternoon. Gov. John Bel Edwards requested a federal major disaster declaration. In his request to the president, Edwards said Louisiana has more cases per capita than any state, except for New York and Washington. We have overwhelmed our stocks of key resources needed for our hospitals, first responders and emergency managers, he wrote. New Jersey added more than 800 cases from Monday to Tuesday, for a total of 3,675 positive tests and 44 deaths. That makes New Jersey the second highest state case total in the nation. Last week alone, New Jersey cases increased tenfold. The state is under a stay-at-home order. Gov. Phil Murphy said not everyone is adhering to the mandate. We must have 100% compliance. This is about public health and it's about people's lives. Your employees' lives, their families' lives, and your life, he said. Michigan's total rose from just 65 cases about a week ago to 1,791 on Tuesday afternoon, including 15 deaths. Pennsylvania saw a spike of more than 200 cases overnight, bringing the total to 851 cases statewide. Of those cases, 7 people have died. Florida and Georgia, 2 states where political leaders have faced criticism over their timing on enacting restrictions, both crossed the 1,000 case mark over the weekend and continue to rise significantly each day. As of Tuesday evening, Florida recorded 1,461 cases and 17 deaths, while Georgia reported 1,097 cases and 38 fatalities. Additionally, Indiana went from a handful of cases about a week ago to 365. California teen's cause of death is complex. The death of a Los Angeles County resident may be the first juvenile to have died from the novel coronavirus in the United States. But hours after saying the person died from COVID-19, the Los Angeles County Department of Public Health issued another news release, saying there might now be an alternate explanation for the death. The department characterized the case as complex, and despite early testing indicating a positive result for COVID-19, further investigation by the U.S. Centers for Disease Control and Prevention would be required. Los Angeles Mayor Eric Garcetti told CNN the person who died was a teenager. The teen lived in Lancaster, California, according to county officials. The news came as more than 52,000 coronavirus cases were reported in the country by Tuesday evening, with nearly half in New York. At least 701 people have died. Coronavirus-related deaths in children remain relatively rare. In the mortality data that has been provided to us, there has been no child under 15 that has succumbed to the virus in Europe, Dr. Deborah Birx, White House Coronavirus Response Coordinator, said during a briefing Monday. There was the one 14-year-old in China. So we still see that there is less severity in children, and so that should be reassuring to the moms and dads out there. According to studies, 2 children, a 10-month-old infant and a 14-year-old boy, died in China after being infected with the novel coronavirus. The 10-month-old who died had a pre-existing condition. The child experienced multi-organ failure and died 4 weeks after being admitted to a hospital in Wuhan, according to research published last week in the New England Journal of Medicine. The 14-year-old boy from Hubei province died February 7. No further details were available on his death, which was reported in a study published last week in Pediatrics that looked at 2,143 children with confirmed or suspected coronavirus.